if we just go over our usual webinar conference information, to please mute or unmute your telephone line by pressing the asterisk and the pound sign. Reminder that you do get CMEs or CEUs for attendance in today's webinar. Information about the disclosure and accreditation is also available on the handout that will be available on our website for today's conference. And I also want to point out that those of you who attend any of our Envision New Mexico telehealth sessions can receive reimbursement for presentation of a melena patient in our discussion. So we'll go on with our webinar after we take a brief roll call, and Kevin Werling, our technical assistant IT expert, will be helping us with that. Kevin?
So yes, anybody who is out there on the line, please unmute yourself, and that's *# again if you need that code, and just let us know who you are and where you're from, and we'll mark you down for your CMEs.
Hello, this is Julie Fitzgerald. I'm from Hidalgo Medical Services down in Lordsburg.
Great, Julie. Glad you could join us this afternoon. Welcome.
Thank you.
Hello, this is Susan Jenks. I'm a school nurse with Albuquerque Public Schools.
Great, Susan. Thanks for joining us. And at what
Thank
school
you.
are you?
I'm over at I'm at a middle school, Desert Ridge.
Desert Ridge. Great. And is there anybody else out there joining us today?
Hi, this is Brian Potratz. I'm a behavioral health counselor at Lordsburg at the School-Based Health Center.
Great, Brian. Appreciate you joining us. And you said you're at Lordsburg?
Yes.
Great. Well, then I gather you're also collaborating with Julie Fitzgerald.
Yes, we work together at the School-Based Health Center here.
That's great.
Hi, Brian.
Hey, Julie.
Awesome. That's what going to fit very well with what we're doing today. I'm really excited about that. Is there anybody else out there connected with us through cyberspace through to today's webinar? I'd like to next take a moment to ask those who are here around the conference table at Studio Envision to identify yourselves, please. Starting with Mr. John Martinez.
John Martinez, Envision, New Mexico.
Nancy Vandenberg, SHIP Project at Envision, New Mexico.
Hi, Courtney Acklin. I'm with Envision, New Mexico.
Kristen Oreskovich, OSAH.
McCain Scharf with the SHIP Project, Envision, New Mexico.
Caitlin Adams with the SHIP Project at Envision, New Mexico.
Nancy Lewis with the Developmental Screening Initiative, Envision, New Mexico.
Great. Well, I'm really glad that you all are here for this afternoon's discussion. So let's get on with those nuts and bolts, or we're going to bolt. I think you've met me before. I'm a child and adolescent psychiatrist who loves giving these webinars from Envision, New Mexico. I'm also a provider in 3 school-based health centers. Currently, my configuration is in Albuquerque Public Schools. I'm also a provider in the pediatric clinic at UNM Health Sciences Center and on faculty in pediatrics and psychiatry. So today's objectives are really important ones for understanding the student health questionnaire. They include identifying health, safety, mental health, and substance abuse screens embedded in the SHQ, as we will revisit. Describe recent changes in the SHQ format, content, and use. And I just want to let you know that As I say revisit, each of these objectives will be posted again as we arrive at the respective sections. We're going to discuss screening implementation with the SHQ, and we're going to identify the risk, strength, resiliency, and protective factor items on the SHQ. And we're going to do all of that this afternoon. Today's webinar embarks on the second item in our series about multimodal screening with the SHQ. We had our introductory overview. It's been about a month ago now, and we're actually repeating today's session from September 16th. By the way, we also have a school-based health center provider case conference forum that may be especially of interest to Julie and Brian, and I hope you'll join us in the future. I'll have some further information about that later in the webinar. So what is screening? I think this is a really important place for where we all begin in looking at the SHQ, and wouldn't you know it, we have a quiz. So screening involves which, if any, of the following: early identification of risk factors. Does it involve assessment/diagnosis? Does it involve treatment? B and C, or all of the above? Who's willing to answer this afternoon? Da, 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 da. Okay, come on. Did I hear somebody out there? Was there somebody in Lordsburg? Go ahead.
Can I go for it? I didn't introduce myself. My name is Julie Brunson. I'm an occupational therapy graduate student at the University of New Mexico.
Oh, Julie, glad you're joining us. And are you going to answer this afternoon's quiz?
I wanted to. I'm a student, so I'm used to answering quizzes.
All right. Go ahead. What's your best answer, Julie?
I think screening is just early identification. I don't think you can do an assessment or a diagnosis just based on a screening tool, nor can you do treatment just on a screening. You would have to do a formal assessment or more a diagnostic tool to do those sorts of things.
Well, that is a great answer, Julie. This webinar is right up your alley because you have just basically encapsulated the entire gist of the question. That screening is really about the identification of risk factors, and it's not intended to be anything else, but commonly it is confused with assessment, and we come up upon this all the time. And it's even been confused with treatment. Often we'll hear discussions here and in clinical venues about an assessment instrument that's really intended for assessment of a condition that's already screened positive as being part of the screening process. So I'm very glad that you gave us such a comprehensive answer to this afternoon's quiz. So thank you for that. So what is in the Student Health Questionnaire, or SHQ as it's known? Why do we bother having students complete the SHQ anyway? Well, here's where we're going to identify the health, safety, mental health, and substance abuse screens embedded in the SHQ. School-based healthcare begins with screening. That's what school-based health centers are about in their approach to identifying problems that students could benefit from having addressed in treatment. We begin with screening. Screening is such a crucial component of comprehensive school-based health care. All students who are served in New Mexico school-based health centers, especially those that are DOH funded, that is through the Office of School and Adolescent Health, are screened for numerous health, safety, academic, behavioral health, and psychosocial risk factors. And in the process, we end up finding some positive things such as their strengths and strength factors and resiliency factors that we'll be talking about later. The SHQ is administered in accordance with OSAH's standards and benchmarks. And consequently, school-based health center behavioral health care often results from screening, in addition to referrals usually received in other clinical venues such as community clinics. And this is something that I think many of us behavioral health providers have to get used to when we start working in school-based health centers, because we usually have been trained in and had experience in our practice in clinical venues where youth are already referred to us after having had their issue or risk factor identified, and with that, the need for assessment. In school-based healthcare, on the other hand, we're screening everybody, and therefore we behavioral health providers end up receiving referrals of students who screen positive and may not have been referred to us because of previously identified problem. And then this also becomes important for our healthcare providers in their role in identifying behavioral health care issues with students. And that's not to say that the SHQ is all about behavioral health, but we sure do generate a lot of behavioral health referrals by utilizing the SHQ, because it's a multiphasic screen. That is, it screens for many things by containing multiple screening tools, all in one. It's concerned with detecting multiple diseases or conditions by risk identification. Risk for each is determined by providers according to factors indicated by students. The basis for this is the GAPS, the Guidelines for Adolescent Preventive Services, that were developed by the AMA in 1997. The recommendations emphasize health guidance and prevention of behavioral and emotional disorders in addition to traditional medical conditions. Now we'll hear GAPS used interchangeably with multiphasic screens utilized in school-based health centers around the country. For example, when we go to the NASBAC conference, NASBAC now known as, anybody in the audience have the new name for NASBAC? School-Based Health Alliance. So when we go to the School-Based Health Alliance conference, or in other ways, conference with school-based health center colleagues around the nation, we'll hear them refer to their GAPS. Well, the GAPS is really not the multiphasic screen itself. It's a set of guidelines that encourage programs such as any of the ones that we work in, and a program like OSAH to develop a multiphasic screen. So as far as OSAH standards and benchmarks, there are the prevention and screening standards that include the Universal Prevention Strategies section. And in that section, there's number 11.1.1. There's not going to be a quiz about that number, I guarantee you. But it points out that primary and behavioral health providers will practice universal health risk screening by administering the SHQ with all students accessing services on their first visit, and that is each academic year. If for some reason, such as acute illness or an emotional crisis preventing the SHQ from being administered during that first visit, which is often very practical, it needs to be completed within 30 days. Now, as of last year, that was a change from preceding years. 2011 and earlier, it was within the first 3 visits. Now it's stated in terms of within 30 days. Well, what does the SHQ screen for? Well, there are these multiple screens embedded within the SHQ, and I have to say that in my work, I find this very helpful to keep in mind. This is from the high school and middle school versions of the SHQ. It screens for, you'll see, a lot of behavioral health factors for depression, anxiety, sleep disturbance, safety in terms of suicidality, self-harm, violence and abuse, substance abuse, utilizing the craft with some additional questions, school factors including learning, academic performance, missing school, skipping school, suspension, relationships within families, within circles of peers and friends, other psychosocial support and stressors, issues pertaining to sex, such as STDs and pregnancy risk, sexual orientation, health issues such as eating and nutrition, body weight and image, exercise and tobacco usage, and known medical conditions, which themselves impose great factors influencing students at school, such as the chronic conditions of diabetes, asthma, and seizures. It also asks about dental care. So we can see that it asks about a lot in many different areas. There are 3 versions of the SHQ for elementary, middle, and high school respectively. The elementary school level, similar topics are asked about in age-appropriate ways, especially about medical history, and it's completed by parents. The middle school version is quite similar to the high school version with language compatible with early adolescent development, as well as what would be considered the tween years. There are demographic and confidentiality boxes at the top, and there also are Spanish versions. Well, I think many of us around the table, and, pardon me, as I cancel that, I'm going to attempt to bring this up here. I'm looking to our IT expert to help me escape. Okay, great. Thank you, Kevin. I want to pull up the SHQ that I'm glad to see that we have here. And we'll see that there is the high school version of the SHQ with its confidentiality statement on the top, information about demographics, questions about sexual orientation, home and school factors, health behaviors, safety and injuries, feelings and well-being, 2 questions about anxiety, 2 questions about depression, 2 questions about harmfulness, relationships and sexual activity, health behaviors, including substance abuse. It's an interesting way to think about substance abuse because it really is an important health behavior. It's also important in psychiatric comorbidity, by the way. And then about development and future plans. And after review by the healthcare provider, there is a signature here, the date that it's reviewed with the student, and to where the student is referred. There also is the middle school version of the SHQ, grades 6 through 8. And we'll see a striking resemblance to the high school version. So I'm just going to scroll down. Very, very similar. Very similar format. Very similar. And the elementary school version is the one that has not been revised recently. The middle school and high school version was, but the elementary school version has not been changed recently. And consequently, it's a bit longer. I just wanted to scroll through and give a sense of how long it is, even at the elementary school level. Okay? And let's talk about and I again want to mention that there are Spanish versions of the three respective versions of the SHQ available as well. Well, as we talk about the SHQ, it's important that we talk about what new developments have come into use this school year and really in the last 2 school years. And the most recent changes have been in the high school and middle school version. The high school revision was implemented last school year, and over the course of last school year, the new version of the middle school format also came about. Currently, OSAH and CHIPRA sites, that is OSAH funded and CHIPRA sites, have this revised so-called ESHQ in the high school and middle school versions. And as I was saying, this has not yet been revised at the elementary school level. It's the same ESHQ that's used in paper forms and in some sites on the iPad. The paper form of the new high school and middle school ESHQ is being used in all of the OSAH-funded school-based health centers. The CHIPRA sites are using it on the iPad, as well as some of the DOH-funded sites have the iPad. And it's really a great experience, as I was telling McCain earlier this afternoon. It wasn't until very recently that I got to use the ESHQ on the iPad. And rather than it being a 2-page document to handle in paper form, it ends up being essentially a single page, and that too can be printed out and reviewed with the student rather quickly. It highlights areas of concern. It makes it very easy to find out where the risk factors are and what needs to definitely be reviewed with the student. It's also interesting to see that while the high school version is considerably shorter than earlier versions, there are actually more screens in the new middle school version. And both the middle and high school ESHQ have been shortened considerably. The high school version used to be 6 pages long. It's now 2 pages long. The middle school version is actually shorter too, and they're now both about 2 pages long, but the middle school version actually has more screens built into it. These multiphasic screens are based on evidence-based practices as well as empirically supported approaches. That is to say, there are some areas that have a true evidence basis. There are others that are empirically supported. Well, who administers the SHQ and when? And what needs to be done with a completed SHQ? And who interprets it? So let's discuss screening implementation. Who is qualified to review and interpret the SHQ? Our providers are qualified for these tasks. Primary care providers, As I'm sure, Julie, you've been doing this. Brian is a mental health provider. I'm sure you've been doing this. Okay. And by the way, all providers in school-based health centers do this. It's something that we all do. It's something we share in common. It's one of our overlapping roles that permits school-based health center care to be so comprehensive. Registered nurses also review and interpret SHQs in collaboration with the providers. Well, when the SHQ is administered, what are the provider responsibilities? Well, it's very important to be present long enough to review, interpret, and respond during the visit, and that is during the first visit. To be able to write comments in the SHQ, to sign and date a completed SHQ in the areas shown earlier, to plan follow-up steps before ending the visit. All of that needs to be accomplished. So that's where it really behooves all providers to make sure that there is enough time to accomplish those things. And you can see that this point is being emphasized in today's webinar because it can be really easy to overestimate how many of these we can accomplish in a finite amount of time. I think we need to be realistic. We also need to make sure that we're not scheduling more new student visits than the number of SHQs that we complete or the students complete in a day. Because we don't want there to be a situation where the student completes an SHQ, but it doesn't get administered in that same clinic visit. Because there could be a chance that there could be a severe risk factor that has been indicated on the SHQ without there having been a review, interpretation, and necessary steps taken. Okay. There's a step shown here on the slide about the provider entering health guidance and risk assessment indicators in the school-based health maintenance record regarding the findings on the SHQ. I'd like to comment on that briefly. OSAH has provided a form that providers become very well versed in, the SBHC health maintenance record. Usually it's present on the left-hand side of the chart in front. It follows the tradition in medicine of having a chart face sheet, if you will, often referred to as a problem list. This one includes a lot more information than a problem list. And you can see the problem list toward the upper third, along with medical history and family history. You'll find that partway down, there's a section that has been outlined here about the student health questionnaire. Okay? And for a date of review, such as today, there are indications made for where there is a positive screen. Okay? And basically, well, we'll go over where screens are positive. This replaces a previous approach, by the way, where risk factors were rated based on whether the risk was found to be low, medium, or high. Nowadays, we indicate whether the screen was positive or not. And in addition to making those marks on the health maintenance record, entering a short note in the medical chart is also very important. And that could be as brief as the SHQ was administered, as well as reviewed and interpreted with the student. So other considerations when administering the SHQ, some of which have already been touched on. It's important not to administer or complete the SHQ prior to the first clinic visit. Okay, sometimes SHQs have been sent home with students along with the SBHC registration form with instructions to bring it back to the clinic. Well, that runs into the same kind of risk, essentially, of exceeding capacity of the maximum number administered in a day, exceeding the number of students seen that day. It's really important that there be a same-day review and interpretation of a completed SHQ. Our school-based health center coordinators, assistants, and clerks have a very important role in helping with this process. Insofar as that they can give the SHQ to students to fill out while they wait to see the provider. Providers and clinic staff often assist students who have trouble reading the SHQ, as well as to offer verbal explanations and reassurance of confidentiality. Opening comments can include, we would like you to fill this form out completely, but you can choose to skip questions that you do not want to answer. Students may not want to write a risk behavior, yet be willing to talk about it when the SHQ is reviewed with them, and vice versa. Okay? There are some students who don't want to talk about it and are really glad that they can indicate something on an SHQ that they don't want to talk about. Providers often ask additional questions when reviewing the SHQ with the students based on the students' responses. And the SHQ is very useful in screening during the EPSTAT, and really begins the EPSTAT process. Well, our clinical judgment is very important when reviewing and interpreting the SHQ. Providers rely on their training and experience and best clinical judgment when administering or reviewing the SHQ, determining risk, and planning next steps, that is, for assessment and intervention. This process of interpreting the screen may itself reveal a need for case consultation. And we will be talking more about determining risk using the revised SHQ next Monday afternoon. Excuse me, I think that's Tuesday. Tuesday, October 8th. My mistake on that. Tuesday, October 8th. We will be talking about determining risk using the new SHQ. Okay? Well, in addition to problems and risk factors, how are strengths, resiliency, and protective factors identified? Well, let's identify risk, strength, resiliency, and protective factor items in the SHQ. And what better way to have, in fact, there's a student coming in this afternoon. He's a 14-year-old multiracial male who's going to help us find these various factors about him as reflected in his SHQ, because he's just arrived, referred by the teacher during sixth period, upset about how this semester's going. He describes bad stuff at home and an inability to complete assignments. Well, it turns out that his mom has already completed the SBHC registration form and given her consent on that form. So the student is given the appropriate SHQ to complete. And it turns out that there are positive screens for safety, feeling/well-being, health behaviors, and substance use risk factors. There also are some strengths that are identified, such as seeking support and help, wanting to quit using substance, and describing very good goals. So as far as the screening and well-being items, this very handy area of crucial mental health issues has been condensed down to 6 items of the SHQ. The first 2 questions being about depression, known as the PHQ-2 modified. It's one of the evidence-based practices within the SHQ. Remember earlier it was mentioned that they're both evidence-based practices and empirically supported approaches. So in the PHQ-2 modified, the student answers yes to noticing that he's basically had a dysphoric mood and a sense of hopelessness in the past 2 weeks. By the way, the major modification on the PHQ-2 here is the addition of the word irritable, as that is often how dysphoria or depressed mood is experienced by youth. And that this youth is also noticed experiencing less enjoyment or interest in doing things the past 2 weeks. Well, that would constitute a positive screen for depression using the PHQ-2. There's also a positive screen for anxiety insofar as the student indicates yes to both questions about the cognitive and emotional aspect of anxiety, about worrying and feeling like something bad might happen, as well as the physical sensation of feeling tense, stressed out, having difficulty relaxing. Fortunately, this student does not endorse either item regarding self-harm, both with regard to suicidality and non-lethal self-injury. But those are 6 items that are on both the high school and middle school SHQ. He also indicates yes on half of the 6 craft questions, which is the craft being another evidence-based practice within the SHQ. The young man indicates that he has ridden in a car driven by someone who was high or had been using alcohol or drugs, and that he has used alcohol or drugs to relax, feel better about himself or fit in, and that he's used these substances when alone. The other 3 items about being forgetful, concerned others, or others concerned about his substance use, and getting in trouble while under the influence were all answered negatively. Well, there are the other SHQ items. Here again, in terms of the high school SHQ, this young man indicates that he usually does not get 8 or more hours of sleep every night. A strength for him is that he feels that there are others he can really talk to, such as his mom and a teacher. He does indicate that there are violence and fighting at home, and that he's had problems in school this semester with his grades, missing school, completing homework, and being bullied, both in person and in texting. Safety or injury items include that, fortunately, does not include him carrying a weapon, but that he has been physically and emotionally abused in the past by his stepdad. Now here are some strengths. Under development and future plans, he indicates 4 out of 5 about how much he likes himself and about future plans for having a family and career goals. He states that he wants to quit weed, graduate, and go to college. Well, at this point, I would want to open it up as we're 2/3 the way into our hour and ask if anybody has any questions, concerns, comments, thoughts, beliefs, even protests about what's been presented this afternoon. I thought that I would show an example of what the health maintenance record would now look like for this young man. Now that we've screened him, this 14-year-old male now has a health maintenance record that's still pretty blank. It's his first visit, right? He just entered upon being referred. He's been screened about the kinds of problems he's having, and notation is made by Paul and provider for risk factors in the areas of home and school, health behaviors, safety/injuries, well-being, health behaviors and substance use, and some notes written in here about development and future plans. Seeks support, likes himself, and has future plans.
Dan, this is Nancy. Can you or Kristen or the folks at Lordsburg let us know if they have an EHR, how are they handling this? Are they completing this paper document and scanning it into their EHR, or are some of them building a template where they can complete this in their EHR?
Hi, this is Julie down in Lordsburg. I was just thinking about that. We do scan the paper copy of the SHQ where I've written my comments, but we don't have this running log of the review anywhere in the chart. And I was thinking maybe we should create that somewhere.
And I'm not, this is Kristen, I'm not sure what every site does. I think that's pretty common that sites with an EHR will scan it in. I don't know if sites vary though, because I haven't gone out to a lot of sites yet. I'm pretty new still. So I don't know, but I can find that out if what other sites are doing with their SHQ, if they're scanning the whole thing in, or if they have some sort of method for tracking.
Well, the question is really this health maintenance record, not the SHQ, because if they have, I know they're instructed if they're using the ESHQ and they have an EHR to scan the SHQ in, but are they keeping this health maintenance record separately? And Dan, you're saying that that's part of the standards and benchmarks, that they have to keep this health maintenance record.
Yes, it's essentially a part of the charting requirements put forth by the Office of School and Adolescent Health.
And Brian, have you seen that at Cobre? Does this look familiar to you at all? Is this something that would be in ECW?
This is Julie again. I also work at the Cobre Clinic, and we're on the same EMR at Cobre and Lordsburg, and we don't have anything like this in it.
So this is something that's come up as we talk about implementing Welligent as an EHR, and our thoughts are that while there won't be this exact form in the EHR, that each of these pieces will be somewhere in the EHR, and that will be important, especially to have like a face page that has all the important information in one place. So I don't know if ECW has that, but that's our hope, is to create like a face page that has all the pertinent, important information that could include something like this chart of the SHQ and when it's done across time.
I would think that it would suffice for programs to develop their own face sheet or overview, as it's been called in EHRs, EMRs. I know the one at UNM has an overview page. And yet, issues come up with each of these modalities. For example, not all providers know how to enter information to an overview or face page on an EHR. So that's one challenge. But I would want to clarify in this regard that traditionally, this has been used in the paper charts in the OSAH-funded school-based health centers. I don't know of OSAH having a requirement that this form be used electronically. I think one drawback of having it scanned is that it's then a static document and it doesn't lend itself to having information added and revised, which is really the purpose.
So it sounds like
I agree with that.
And Julie, maybe you guys could, you guys have recently had an audit. Cindy Greenberg was down there. Well, I say that. She was at Silver and Cobrae. Did you guys have an audit at Lordsburg?
Last spring at the end of the school year.
So I would assume this might be something that would be checked in an audit. So Amanda may know kind of how you guys handle that internally, but maybe we can circle back with you guys after Kristen has a chance to check with the OSAH team about what the requirement is.
Yeah, I don't recall this issue coming up in the audit.
Okay.
Well, I think that's good. I for one would vote for this being an area of further inquiry rather than something that is cited as a deficiency in charting. And in doing so, I would really encourage sites and programs to have a way of showing the older information that was once on the health maintenance record. One of the advantages of the written form was to actually see what had been crossed out. It would show a lot of medical and health and behavioral health history right there on that front form, including medications. Whether it's antibiotics prescribed for STDs, an antidepressant medication or anti-anxiety medication that's no longer being taken. A diagnosis once was there but has since been removed. Those are really valuable aspects of this chart. And it's also very important for tracking the amount of assessment and treatment to date and who are the involved providers. Because it has this area down at the bottom that shows, perhaps it would show that Brian had been involved in providing behavioral health services to this 14-year-old after today's presentation. Or maybe Julie had seen this, will see this student in the coming months or the coming weeks to do an EPSTAT. I know it's awfully quiet out there and in here. Any other concerns, any other thoughts about the SHQ? Julie and Brian, I would really like to hear some more from you about your experiences in using the ESHQ. How do you like it, and do you find it useful in your school-based health center practices?
Well, one of the things that comes up a lot for me, almost every kid answers no to the 5 fruits and vegetables a day and the 8 hours of sleep.
Yeah.
And a lot of them, when I talk to them about feeling like something bad is going to happen, or the anxiety questions, and even the depression questions, when I ask them about that, they say, oh, well, I've had a lot of tests lately. I'm just concerned about schoolwork. Or one girl that I had seen for a sprained ankle, she was just kind of depressed because she'd been sitting around for a couple of weeks and couldn't do her normal activities. So I just write a note next to those answers with a little bit of an explanation that they give me.
No, that's really important because, it isn't really just that the student got depressed because or felt low because they've been sitting around for 2 weeks since their injury. That is a real significant risk factor for depression for a number of individuals. And the more active one is, for example, in the case of an athlete who is training steadily and competing steadily, to have an injury and to lose that aspect of involvement and everything that comes with that involvement is a really big risk factor for depression in those individuals. So that's very significant, even though it may seem, the student may explain it away, or we might explain it away as providers as a temporary issue. It is a real concern in the moment. And for the weeks and perhaps months of recovery.
Well, and that's why I was thinking that it's important for us to have that overview so that we revisit the SHQ, because typically I do it on the first visit, it gets scanned into the chart. If I think they need a referral, I do a referral to behavioral health, but after that, other than when we discuss that patient during our monthly huddles, I'm not revisiting their SHQ answers very often.
Good point. So if there is a way, as you were saying, to have that on the overview. Became really bummed out after their injury, it would flag the person looking at the chart to ask a follow-up question about that. How have you been feeling since your injury? How's your recovery going from the standpoint of your injury, and how are you feeling about that? Are you making enough progress?
And does it make sense to re-administer the SHQ?
It's really intended to be done annually, and it makes more sense to ask about particular parts than to administer the whole thing.
Okay.
So, for example, with the student who answers that they're dysphoric and given up some hope after an acute, awful injury, to ask them those couple feeling well-being questions about depression, perhaps as well as anxiety, perhaps as well as about harmfulness to self, a few months later is a good practice. I have a question I'd like to ask you about. I'd like to hear people's impressions of, let's see here. Under health behaviors, number 4. Do you usually participate in physical activities such as walking, skateboarding, dancing, swimming, or playing basketball for a total of 1 hour every day? How's that question been going?
I think that's usually no.
But what does no mean? Does no mean that they're doing these things less than an hour a day? Or could it mean that they're doing these things more than an hour a day? Now, that may seem really persnickety on the behalf of this presenter, but when I've looked at this question with students, that has gone through my mind. And there are a number of students, depending on where they are in their development, especially when we're talking about middle school and even into early high school, who could make a pretty concrete interpretation of this. No, I'm doing those things 2.5 hours a day, not just an hour. And they could indicate no. So our follow-up questions will clarify that.
Right. Another issue that has come up with the middle school ESHQ, or not ESHQ, we're doing the paper SHQ. A lot of times the parents are filling that out because it's at too high of a reading level for the kids, and oftentimes even too high of a reading level for the parents.
That's a really good point. Go ahead.
Well, I was just thinking, had the child answered the questions, the answers might have been different. So I think we might need to administer it a little bit differently than we are.
And that's a really important thing to consider at your monthly meeting as a team, because it would really require or involve changes within your whole team, including your clinic assistant or clerk, who could really help with helping students understand the questions, clarifying whatever difficulties there are in reading and understanding the questions.
And Julie, this is Nancy. I think if you would be so inclined, if there are particular questions, if it's just generally the whole thing is too high reading level, or if there are specific questions we could recommend be altered. We'll make revisions next summer to next year for next year's version, but if there are, 5 questions that are always problematic and then the rest are sort of relative to the kid, that would be helpful to know. So if as you guys are using it over the school year, if that's feedback you could provide to us, that would be really helpful.
Sure.
Julie, this is Kristen. I was just wondering, are the parents coming with the students to their appointments? Is that how the parents fill out the SHQ, or is the document going home with the students?
They're coming to the appointment with them. They're
okay.
The kids that are under high school age are accompanied by an adult usually.
Okay.
And we're not doing the elementary SHQ.
Oh. I
didn't know there was one.
Well, I'm glad you tuned in this afternoon. It's
Me too.
That is really worthwhile. That is one where we want parents to fill that out. And sometimes it's helpful to mention that when working with middle school students accompanied by parents. And well, now that your son or daughter is in middle school, we ask them to fill it out. We ask parents to fill it out when they're in elementary school. It can actually support the middle school student in acknowledging their development and their capabilities, and reassuring parents that we assist the students with their understanding. And if you're having questions about the SHQ, that we would be glad to discuss this tool with you as well, this questionnaire, whatever you think would be the best language for that. Well, I see that we've arrived at the top of the hour, 4 o'clock already, so I'd like to thank everybody for participating this afternoon. I think you've all been great. You've all had great contributions and certainly kept me from talking anymore. And I've really enjoyed hearing from you. You've had some very thoughtful input, and I can't thank you enough for being with us this afternoon. And I especially want to thank Kevin for all of his help in making this afternoon's webinar possible. So thank you, everybody.